Welcome to Men's Health 365, where we explore evidence-based strategies to optimize your health, vitality, and sexual function. After 60, I'm your host, and today we're covering a topic that's rarely discussed, but absolutely critical: the things you should never do to your penis. These aren't just old wives' tales or minor inconveniences. These are medically documented practices that can cause serious, sometimes permanent damage to your sexual function, urinary health, and overall well-being. Some of these you might be doing right now without realizing the danger. Let's dive into the 9 things you should absolutely never do to your penis if you want to maintain optimal function, pleasure, and health for decades to come. Today, I'm going to share these 9 critical mistakes so you can avoid problems. Number 1, using vacuum pumps incorrectly or excessively. The first thing you should never do is use vacuum erection devices incorrectly or excessively. Vacuum pumps are legitimate medical devices, FDA approved for treating erectile dysfunction, and when used correctly under medical guidance, they can be helpful. However, misuse is extremely common and can cause serious damage. The mechanism is simple. You place your penis in a cylinder, create a vacuum that draws blood into the erectile tissue, then place a constriction ring at the base to maintain the erection. The problems arise when men use pumps that are too powerful, pump for too long, pump too frequently, or use excessive vacuum pressure, thinking more is better. Research published in the Journal of Sexual Medicine has documented numerous complications from vacuum pump misuse, including penile bruising, burst blood vessels, temporary or permanent erectile dysfunction, painful erections, and in severe cases, tissue necrosis requiring medical intervention. David had purchased an inexpensive pump online and was using it daily, sometimes multiple times per day, with maximum vacuum pressure for 15 to 20 minutes per session. He thought he was exercising his penis and improving function, but he was actually causing cumulative damage. The excessive vacuum pressure was rupturing small blood vessels, causing microtrauma to the delicate erectile tissue, and the prolonged constriction rings were cutting off blood flow for dangerous durations. When I examined him, he had visible petechiae, small red or purple spots indicating broken blood vessels, and areas of thickened fibrotic tissue. If you use a vacuum pump, do so only under medical supervision. Use appropriate pressure settings, typically not exceeding negative 200 millimeters of mercury. Limit sessions to 5 to 10 minutes maximum. Never sleep with a constriction ring on, and limit use to 2 to 3 times per week maximum. The penis is not a muscle that grows stronger with exercise. Excessive pumping causes damage, not improvement. Number 2, injecting foreign substances for enhancement. The second thing you should never do is inject foreign substances into your penis for size enhancement or performance. This is becoming increasingly common with men seeking quick enlargement solutions, and it's causing an epidemic of serious complications. Men are injecting substances like silicone, petroleum jelly, mineral oil, and various fillers purchased online or from unregulated sources seeking instant size gains. The medical literature is filled with catastrophic cases. Research in urology case reports and the Journal of Sexual Medicine documents cases of severe infections, granulomas, inflammatory masses that form around foreign material, penile deformity, erectile dysfunction, chronic pain, tissue necrosis requiring partial or complete penectomy, and systemic infections including sepsis. Even substances marketed as safe dermal fillers for facial use can cause severe reactions when injected into penile tissue. The penis has unique anatomy. The erectile tissue is a complex network of blood vessels, smooth muscle, and connective tissue that expands and contracts dramatically. Injecting foreign substances disrupts this delicate architecture. Your body recognizes these substances as foreign invaders and mounts an immune response, creating inflammation, scar tissue, and sometimes attempting to wall off the material in hard nodules. There is no safe substance to inject into your penis for enhancement, and there is no legitimate medical professional who will perform such injections for cosmetic enlargement. If you're concerned about size, understand that surgical and non-surgical enhancement procedures have limited effectiveness and significant risks. The safest and most effective approach to maximize your functional size is optimizing erectile function through cardiovascular health, hormonal optimization, and addressing any venous leak or arterial insufficiency with legitimate medical treatments. Number 3, taking ED medications without medical supervision. The third thing you should never do is take erectile dysfunction medications without proper medical evaluation and supervision. Medications like sildenafil, tadalafil, vardenafil, and avenafil are prescription drugs for a reason. They have real risks and require medical oversight. Yet millions of men purchase these drugs online without prescriptions, from unregulated sources, at incorrect doses, or mixed with recreational drugs. David had been taking sildenafil he purchased from an online pharmacy, sometimes doubling the dose when the standard dose didn't work as well as he wanted. What he didn't realize was that his erectile dysfunction was partly caused by undiagnosed cardiovascular disease, and the erectile problems were an early warning sign. Research in the Journal of the American College of Cardiology has established that erectile dysfunction often precedes cardiovascular events, like heart attacks, by 3 to 5 years, and it's frequently the first symptom of systemic vascular disease. Taking ED medications without medical evaluation means missing these critical underlying conditions. Furthermore, these medications have serious contraindications. They're absolutely contraindicated with nitrate medications used for angina because the combination can cause life-threatening drops in blood pressure. They can interact dangerously with alpha blockers used for prostate enlargement. They can cause priapism, painful erections lasting more than 4 hours that require emergency treatment to prevent permanent damage. They can cause sudden vision or hearing loss in susceptible individuals. Research in JAMA ophthalmology has documented cases of non-arteritic anterior ischemic optic neuropathy associated with PDE5 inhibitor use. Additionally, counterfeit ED medications purchased online are common. Studies analyzing pills from online pharmacies have found that up to 40% contain incorrect amounts of active ingredient, dangerous contaminants, or completely different drugs. If you're experiencing erectile dysfunction, see a physician for proper evaluation. This should include cardiovascular assessment, hormonal testing, and screening for diabetes, all of which commonly contribute to ED and require treatment beyond just masking symptoms with pills. Number 4, ignoring persistent curvature or Peyronie's disease. The fourth thing you should never do is ignore persistent penile curvature or symptoms of Peyronie's disease. Peyronie's disease involves the formation of fibrous scar tissue inside the penis, causing curved, painful erections, and it affects approximately 6 to 10% of men, with prevalence increasing significantly after age 50. Early intervention dramatically improves outcomes, but many men delay seeking treatment due to embarrassment or hoping it will resolve on its own. It typically doesn't. Research published in the Journal of Urology shows that Peyronie's disease is progressive in the majority of cases without treatment, and the longer you wait, the more difficult it becomes to treat effectively. David had noticed gradual curvature developing over about 6 months, along with feeling a hard lump or plaque under the skin of his penile shaft, but he delayed seeing a doctor for over a year. By the time he sought help, the curvature was severe enough that intercourse was difficult and painful. Peyronie's disease has 2 phases. The acute or active phase typically lasts 6 to 18 months, during which the curvature and plaque are actively forming and changing. This is when treatment is most effective. Options during this phase include oral medications like pentoxifyline or vitamin E, though evidence is mixed, intralesional injections with collagenase, or verapamil, which can break down collagen in the plaque, extracorporeal shockwave therapy, and penile traction devices. The chronic or stable phase occurs after the disease stabilizes, typically after 18 months. Treatment options in this phase are more limited and often require surgery, plication procedures, where the longer side of the penis is shortened to match the curved side, grafting procedures, where the plaque is removed or incised, and a graft is placed to lengthen the shortened side, or penile prosthesis implantation in severe cases with significant erectile dysfunction. The key point is this: if you notice any persistent curvature, lumps, pain with erection, or changes in erection quality, see a urologist immediately. Early treatment during the acute phase can often prevent progression and preserve function. Waiting reduces your options dramatically. Number 5, aggressive or rough handling during sex or masturbation. The 5th thing you should never do is engage in aggressive or rough handling during sexual activity or masturbation that causes pain, bruising, or trauma. The penis contains delicate structures, the corpora cavernosa filled with erectile tissue, the urethra running through the corpus spongiosum, blood vessels, nerves, and a relatively thin layer of skin. Excessive force, bending, or trauma can cause penile fracture, which, despite the name referring to rupture of the tunica albuginea surrounding the erectile tissue rather than an actual bone break, is a medical emergency. Research in urology annals shows that penile fracture most commonly occurs during vigorous intercourse when the erect penis slips out and strikes the partner's pubic bone or perineum, but it can also occur from aggressive masturbation, bending an erection, or rolling over onto an erection during sleep. Symptoms include a popping or cracking sound, immediate loss of erection, severe pain, rapid swelling, and dark bruising. This requires immediate surgical repair, typically within 24 hours, to prevent permanent erectile dysfunction, curvature, and other complications. Beyond acute fracture, chronic aggressive handling causes cumulative microtrauma. David admitted to very aggressive masturbation techniques, including significant bending and twisting, multiple times daily for years. This had likely contributed to his Peyronie's disease development and erectile dysfunction. Research published in the Journal of Sexual Medicine has documented that repetitive microtrauma from aggressive sexual practices is a contributing factor in Peyronie's disease development. The repeated minor injuries cause inflammation and abnormal wound healing, leading to plaque formation. Additionally, excessive or aggressive masturbation using tight grip or excessive friction can lead to decreased sensitivity over time, a phenomenon sometimes called death grip syndrome, where men condition themselves to require intense pressure that a partner cannot replicate, leading to difficulty achieving orgasm during partnered sex. The solution is moderation and gentleness. Treat your penis with respect. Avoid positions or practices that bend or force the erection at unnatural angles. If something causes pain, stop immediately. Use adequate lubrication to reduce friction. And honestly, if you're masturbating multiple times daily, especially aggressively, consider reducing frequency. Quality over quantity applies here. Number 6, using numbing creams or sprays excessively. The 6th thing you should never do is excessively use topical numbing agents containing lidocaine or benzocaine to delay ejaculation or reduce sensitivity. These products are marketed for premature ejaculation treatment, and when used appropriately and sparingly, they can be helpful for some men. However, excessive or chronic use causes several serious problems. First, these are potent local anesthetics that work by blocking nerve signals. Overuse can cause prolonged or permanent reduction in penile sensitivity. Research in the Journal of Sexual Medicine has documented cases of men who use these products chronically and developed persistent genital numbness, requiring months or years to partially recover. Second, these numbing agents don't just affect you. They transfer to your partner during intercourse, causing numbing of their genitals as well, which reduces their pleasure and can interfere with natural lubrication. Third, some men develop allergic contact dermatitis from these products, causing inflammation, rash, itching, and further damage to the sensitive penile skin. Fourth, relying on numbing creams as a solution to premature ejaculation addresses the symptom but not the underlying cause, which might be psychological anxiety, pelvic floor dysfunction, or hormonal imbalance that would benefit from proper treatment, David had been using a numbing spray regularly for over a year, applying it heavily before intercourse. He reported that sensation had progressively decreased to the point where he was having difficulty achieving orgasm despite adequate erection, creating a different problem than the one he started with. When he discontinued the spray, it took approximately 4 months for sensation to gradually return to near normal levels. If you experience premature ejaculation, consider evidence-based treatments like pelvic floor therapy, focusing on relaxation techniques, selective serotonin reuptake inhibitors under medical supervision, behavioral techniques like the start-stop method, or addressing underlying anxiety with therapy. If you do use topical anesthetics, use them sparingly, apply only the minimum effective amount, allow adequate time for absorption before intercourse, and consider using a condom to reduce partner transfer. Never use these products multiple times daily or for extended periods without medical supervision. Number 7, neglecting hygiene or ignoring infections. The 7th thing you should never do is neglect proper genital hygiene or ignore signs of infection. This seems obvious, but it's surprisingly common, especially among older men who may have reduced mobility, declining cognitive function, or simply aren't aware of proper practices. Poor hygiene leads to accumulation of smegma under the foreskin in uncircumcised men, bacterial overgrowth, yeast infections, balanitis, which is inflammation of the glands, posthitis, which is inflammation of the foreskin, and increased risk of sexually transmitted infections. Research in the International Journal of STD and AIDS has shown that poor genital hygiene is a significant risk factor for HPV transmission and persistence, which is linked to penile cancer. Proper hygiene means daily gentle cleaning with warm water, pulling back the foreskin fully if uncircumcised, and cleaning underneath, using mild, unscented soap if desired. Though water alone is often sufficient for the glands and foreskin, thoroughly drying after washing, and promptly addressing any unusual discharge, odor, redness, itching, or lesions. Equally important is not ignoring signs of infection. David had experienced several episodes of balanitis that he treated with over-the-counter antifungal creams without seeing a doctor. What he didn't realize was that recurrent balanitis can be a sign of diabetes, which he was eventually diagnosed with. Research in diabetes care shows that recurrent or persistent genital yeast infections in men are often the presenting symptom of previously undiagnosed diabetes. The elevated blood glucose creates an ideal environment for yeast overgrowth. Additionally, untreated sexually transmitted infections can cause serious complications. Gonorrhea and chlamydia can cause urethral stricture, scarring that narrows the urethra and causes urinary problems. Untreated syphilis can cause systemic complications, including neurological and cardiovascular damage. Human papillomavirus is linked to penile cancer. If you notice any unusual symptoms, discharge, burning with urination, lesions, persistent redness, unusual odor, or any other changes, see a doctor promptly. Don't self-diagnose or self-treat persistent or recurrent problems. Proper medical evaluation can identify underlying conditions and prevent serious complications. Number 8, testosterone abuse or using anabolic steroids. The 8th thing you should never do is use testosterone or anabolic steroids without proper medical supervision at supraphysiologic doses or for purposes other than treating diagnosed hypogonadism. Testosterone replacement therapy under medical supervision for men with genuinely low testosterone can improve energy, mood, sexual function, and quality of life. However, testosterone abuse causes serious problems, including testicular atrophy and shrinkage, sometimes permanent, fertility impairment, or complete infertility due to suppression of sperm production, increased risk of cardiovascular events, including heart attack and stroke, particularly at high doses, elevated red blood cell count, increasing risk of blood clots, prostate enlargement potentially worsening urinary symptoms, and gynecomastia, which is breast tissue development due to conversion of excess testosterone to estrogen. Research in JAMA has documented significantly increased cardiovascular risk in older men receiving testosterone therapy, particularly those with pre-existing cardiovascular disease or multiple risk factors. Additionally, when you take external testosterone, your body's natural production shuts down through feedback inhibition. If you then stop taking external testosterone without proper tapering and post-cycle therapy, you can end up with testosterone levels lower than before you started, leading to severe symptoms. David had used testosterone purchased from a gym contact for about 8 months, taking doses approximately 3 times higher than therapeutic doses, hoping to improve his erectile function and build muscle. This had contributed to his problems rather than solving them. His testicles had noticeably shrunk. His body had ramped up aromatase activity, converting the excess testosterone to estrogen, causing breast tissue development and paradoxically worsening his erectile function. And when he abruptly stopped due to cost, his testosterone crashed to extremely low levels, causing severe fatigue, depression, and complete loss of libido. Recovery required several months of medical management. If you have symptoms of low testosterone, fatigue, decreased libido, erectile dysfunction, mood changes, decreased muscle mass, get properly evaluated with comprehensive testing, including total testosterone, free testosterone, SHBG, estradiol, LH, and FSH. If treatment is warranted, work with a knowledgeable physician who monitors you regularly. Never use supraphysiologic doses. Never purchase from unregulated sources, and never use anabolic steroids for athletic or cosmetic purposes. The risks far outweigh any potential benefits. Number 9, ignoring persistent erectile dysfunction. The 9th and perhaps most important thing you should never do is ignore persistent erectile dysfunction. Many men dismiss ED as just a normal part of aging or an embarrassing problem they need to live with. This is wrong on multiple levels. First, as mentioned earlier, ED is often an early warning sign of serious underlying conditions, including cardiovascular disease, diabetes, hypertension, hormonal disorders, neurological conditions, and psychological disorders like depression. Research published in Circulation established that men with ED have significantly elevated risk of cardiovascular events in the subsequent years, and treating the ED without addressing underlying cardiovascular disease is like putting a Band-Aid on a bullet wound. Second, ED significantly impacts quality of life, relationship satisfaction, and psychological well-being. Research in the Journal of Sexual Medicine has consistently shown that ED is associated with depression, anxiety, reduced self-esteem, and relationship strain. These effects extend to partners as well. Third, early intervention for ED is far more effective than waiting until the condition is advanced. Many causes of ED are treatable or reversible if caught early, including hormonal imbalances, medication side effects, psychological factors, and early vascular disease. David's erectile dysfunction was multifactorial. He had undiagnosed diabetes, low testosterone, cardiovascular disease, Peyronie's disease from trauma, and psychological performance anxiety. By ignoring the problem for years, each condition had progressed and compounded the others. Once we addressed each factor systematically, controlling his diabetes, optimizing his testosterone, treating his cardiovascular disease with lifestyle changes and medication, treating his Peyronie's disease, and providing psychological support, his erectile function improved dramatically, though not to pre-problem levels, because some damage was irreversible. If you experience erectile dysfunction that persists for more than a few months or occurs more than half the time, see a physician for comprehensive evaluation. This should include cardiovascular assessment with blood pressure, cholesterol, and possibly stress testing, diabetes screening with fasting, glucose, and hemoglobin, A1C, comprehensive hormone panel, psychological assessment, and review of all medications for potential side effects. Treatment can then be tailored to address the specific underlying causes rather than just masking symptoms with pills, David's recovery, and key takeaways. Let me tell you about David's recovery after we identified all the practices that were harming him and implemented comprehensive treatment. He immediately stopped using the vacuum pump except under my specific guidance, with appropriate pressure and frequency. He never considered injection of foreign substances again. He began taking tadalafil at an appropriate dose under my supervision after cardiovascular clearance, and we addressed his underlying diabetes and cardiovascular disease. We treated his Peyronie's disease with intralesional verapamil injections and penile traction therapy during the active phase, which stabilized the curvature and prevented further progression. He stopped the aggressive masturbation practices and adopted gentler techniques with adequate lubrication. He discontinued the numbing spray and focused on pelvic floor relaxation techniques for the premature ejaculation that had developed. He improved his hygiene and treated the recurrent balanitis properly, which resolved once his diabetes was controlled. He avoided any further testosterone abuse and worked with me to optimize his testosterone through proper replacement therapy at physiologic doses. After 6 months of this comprehensive approach, David reported that his erectile function had improved from his baseline of barely functional to achieving satisfactory erections about 70% of the time with medication. His curvature had stabilized and was manageable. His sensitivity had returned to near normal after discontinuing the numbing spray. His genital infections had completely resolved. His testosterone levels were optimized, and he felt dramatically better overall. His relationship with his wife had improved through better communication and reduced performance pressure. While he didn't return to the function he had before all the problems developed, some damage was permanent. He went from considering giving up on sexual activity entirely to having a satisfying sexual life. The key lesson from David's story is that prevention is far better than treatment. Avoiding these 9 harmful practices from the start would have prevented years of problems and permanent damage. Here are your key takeaways. Your penis is not indestructible. Treat it with respect. Avoid aggressive handling, excessive force, or practices that cause pain or trauma. Never inject foreign substances into your penis for any reason. If you use devices like vacuum pumps, do so only under medical guidance with appropriate settings and frequency. Never take prescription medications, including ED drugs or testosterone, without proper medical evaluation and supervision. Address problems early. Don't ignore persistent curvature, erectile dysfunction, infections, or any other concerning symptoms. Early intervention is far more effective and prevents complications. Practice proper hygiene and maintain regular checkups. Many penile problems are preventable or easily treatable if caught early. Understand that sexual function is connected to overall health, cardiovascular disease, diabetes, hormonal disorders, and psychological health all impact penile function. Optimizing your overall health optimizes sexual function. Finally, don't be embarrassed to seek help. Urologists and sexual medicine specialists see these issues every day. Waiting because of embarrassment only allows problems to worsen and become harder to treat. The 9 things you should never do to your penis: using vacuum pumps incorrectly or excessively, injecting foreign substances for enhancement, taking ED medications without medical supervision, ignoring persistent curvature or Peyronie's disease, engaging in aggressive or rough handling, using numbing creams excessively, neglecting hygiene or ignoring infections, abusing testosterone or anabolic steroids, and ignoring persistent erectile dysfunction are all common but potentially devastating mistakes. Some cause immediate damage, others cause cumulative damage over months or years. All are preventable with knowledge and appropriate care. Your sexual health is an important component of your overall health and quality of life. It deserves the same attention and care you give to your cardiovascular health, your metabolic health, and your mental health. Protect it by avoiding these 9 harmful practices and seeking appropriate medical care when needed. Thank you for watching Men's Health 365. If you found this video helpful, Please like, subscribe, and share it with other men who might benefit from this potentially life-changing information.